Hey guys, today we're going to be talking to Dr. Shridharani of Lux Surgery in Manhattan, and we're going to be asking him all the questions about guys and what they're doing with Botox. Have you seen an uptick in men coming in to get Botox since you've started your practice?
100%, no question. There's much less stigma nowadays associated with men getting aesthetic treatments, right? Botox falls under a category of neuromodulators, which are basically, they inject like water, like substance, and what they do is they help a nerve and a muscle not communicate for a period of a few weeks and months. So effectively what happens is that after it's injected, the muscle and the nerve can't really communicate, so the muscle doesn't move as much. So that way you don't have lines and creases, and over time it relaxes them more and more because you're not using that muscle for weeks or months at a time.
What are men coming in to get Botox for versus women?
When I'm dealing with my classic female patient, they typically come in requesting and hoping to look younger. Whereas the male patients are typically saying, make me look fresher, I don't want to look different, just want people to say, wow, he looks really rested. So Barrett, first thing we're going to do right before we inject is good old-fashioned cleaning the skin. So Kasha's going to go ahead and clean everything off with some rubbing alcohol just to prep the area. We're injecting something that's the consistency of water. So it's not thick, it's not viscous, and we inject tiny amounts. Literally 0.1 mLs at each injection site. So you're talking about 1/10 of a milliliter. So even though you're gonna do fantastic and not have a lot of pain, we're giving you a good old-fashioned silicone gel breast implant to squeeze as your stress ball in case you have any issues, okay? Perfect. So next step is we're gonna go ahead and start icing the side of your crow's feet that we're gonna treat. All right, so go and smile really big for me. Perfect, I see my lines here. We're gonna feel a series of a couple of pinches. Go and relax. So you're gonna feel tiny little pinch. Perfect, good. Small pinch. You're doing fantastic. Perfect, and that's it. We just finished that side and it's like we weren't even there, minus the tiny amount of little fluid bulge, and that mosquito bite's gonna go away in a matter of minutes. We're gonna do the same thing on this side now. Same thing, small pinch, perfect. And a small little pinch right there, if you even felt one at all. And that's it on that side.
You don't really feel much of anything.
So now what we're gonna do is we're gonna go right in between your eyebrows to get rid of those angry 11s. So bring your eyebrows together, good, and relax. Series of couple little pinches right here. And small little pinch right here. Perfect.
Do you bleed a lot when this is happening? Am I bleeding?
Not at all. You get a small little drop sometimes. If anything, just for a few minutes after you look like you have a mosquito bite. Because remember, we are putting fluid, so it does cause it to bulge up a little bit. But literally, the ones from around the side of your eyes have already flattened out. So it's just minutes before it goes away. So now we're gonna work on relaxing that forehead. I'm gonna go ahead and bring your hair up here. Perfect. Raise your eyebrows really nice and high. Good. Perfect. And relax. Great, series of small pinches, small pinch, pinch, perfect, pinch. You're doing fantastic.
It feels more just like an irritation.
Pinch.
That one I felt a little bit more.
We are literally 5 to 10 seconds away from being completely done with this treatment. You're just getting a few little pokes left just to really knock out any of that additional muscle motion and work on giving you a little lift. And you are done. We're gonna put some ice on there just to help make sure that it takes care of any additional swelling or any bruising, but
When will I see results, and do I need to come back in anytime in the future to check in with you?
usually you'll start to see the peak effect by the time you hit close to 10 to 14 days. So I'd love for you to come back in about 10 days. It makes sense for me to just reassess. If we need to add a drop more here and there, we can take care of that. Or we're just gonna bless everything that we see and you're pretty much done and on your way until your next treatment in probably around 3 to 5 months.
All right.
You did great.
Thank you so much.
Absolutely.
This was so exciting.